I was staying on health matters. A group in Lagos State has commemorated World Pulmonary Hypertension Day with a walkathon. The day is celebrated yearly to raise awareness and celebrate persons living with the disease. We have details in this report.
Pulmonary hypertension, often misdiagnosed as other respiratory and cardiovascular conditions, is a type of high blood pressure that affects the lungs and the right side of the heart. According to research by the National Heart, Lungs and Blood Institute, about 1% of people globally have pulmonary hypertension. More than 50% of cases worldwide have no known cause, and no fewer than 100,000 cases are recorded yearly in Nigeria. To promote and raise awareness about pulmonary hypertension in Nigeria, a group held a walkathon called Walk for PH. As a way to combat this disease, the group provides emotional, psychological, and financial support to persons living with the disease.
Our awareness has been very effective. We've reached out to over 2,000 people since we started creating awareness for pulmonary hypertension in Nigeria. Last month, for instance, we were able to provide the required medications for one of the persons living with pulmonary hypertension. Managing pulmonary hypertension is quite expensive.
Health experts say there is little or no knowledge about the disease in Nigeria.
Most Nigerians are not aware of this kind of hypertension, and that's why we're creating this awareness.
Ayotunde Omitogun, who has lived with the disease for 10 years, talks about how it has affected her and how she copes with medication.
It has been really difficult. Pulmonary hypertension is a rare disease and it's still very unknown in Nigeria. So there's a lot of misunderstanding surrounding the disease, and also getting treatment for the disease is not very easy. Unfortunately, pulmonary hypertension has no cure, but can be treated with medication just to improve symptoms and reduce the progression of the disease. But these medications are still very limited. So a lot of times, if some reasons I can't get the medication, especially during COVID-19, I'm always sick during that period.
Similar to some illnesses, symptoms of the disease include shortness of breath, chest pain, and lightheadedness.